Welcome back to my channel. If you are visiting this space for the first time, you are also highly welcome. In this channel, we simplify anatomy, and here we also learn anatomy with so much fun. In this lecture, we would be looking at the subclavius muscle. The subclavius muscle is a muscle that is located below the clavicle. Sub means below, so it is located below the clavicle. In this lecture, we would be looking at how this muscle originates and where it's finally inserted upon. We'll also be looking at the blood supply and also the innervation of this muscle, and also some other details that you should know as students of anatomy. The subclavius muscle, we say that it is a muscle that is located below the clavicle. We already highlighted this in our previous slide. It is a triangular small muscle that is seen to be located below the clavicle. If you look at this image up here, this is where we have the subclavius muscle here highlighted in red. You can see that this muscle is located below the clavicle. This is where we have the clavicle at this upper region. I've also put up a lecture on the clavicle. If not check up that lecture, please kindly go and do so to keep yourself updated. So this is where we have the clavicle here, a long bone that is horizontally placed. And below it is where we have the subclavius muscle. We say that it is sub because it is located below the clavicle, just as the name implies. This muscle is seen to be located deep to the pectoralis major. If you try to use this other side of the image, this is where we have the pectoralis major muscle here highlighted in blue. You see that this muscle is seen to be overlying on the subclavius. And this is why the subclavius muscle is not palpable. The subclavius muscle is also one of the muscles of the pectoral region, but it is seen to be located deep to the pectoralis major muscle. So it's important that we highlight this in case we are asked during examination. The subclavius muscle is not palpable because it is located below the clavicle and it is also overlying by the pectoralis major muscle. And this is why you cannot palpate this muscle. So now let's look at the origin of this muscle and also where it is inserted upon. It is seen to originate from the first costochondrial joint. The first costochondrial joint is the region where the first rib connects or unites with the first costal cartilage. If you try to use this upper image, this is where we have the costochondrial joint here at this region that is arrowed in black. At this point, you have the sternal end of the rib connecting to the costal cartilage. If you go back to our lecture on the rib cage, we highlighted in that lecture that the ribs are not connected directly to the sternum. This is where we have the sternum at this anterior midline region. It is also referred to as the breastbone. The ribs are not directly connected to the sternum. They are seen to be connected through the costal cartilages. This means that the ribs are first connected to the costal cartilage before the costal cartilages will then be connected to the sternum. So there is no direct connection between the ribs and the costal cartilage. This is what this means. So if you look at the first costochondrial joint, you see that it is a region where the sternal end of the rib is connecting to the costal cartilage. Before the costal cartilage will then be seen to be connected to the sternum. Specifically at this upper region, it will be connecting to the manubrium of the sternum, because we know that the manubrium is the superior region of the sternum. We also know that the sternum is divided into three sub-regions. We have the manubrium at this upper region, we have the body, and we have the xiphoid process. So at this superior region, because now we are focusing on the first costochondrial joint, which is going to be at this upper region, this means that this connection will be created around the region where we have the manubrium. So it is at this region where we have the first costochondrial joint that we have the origin of the subclavius muscle. And at this point, you see it being directed laterally. This is where we have the medial region, and this is where we have the lateral region. So you see the fibers of the subclavius muscle are driven laterally, and this is where they are finally inserted on the subclavian groove. The subclavian groove is seen at the inferior region of the middle third of the clavicle. Let's try and use this lower image to describe this. If you look at this region, this is the clavicle, and the inferior surface of the clavicle is what is exposed here in this image. And if you try to divide it into three, we have the lateral third, we have the middle third, and we have the medial third. So this is where we have the medial third here that is close to the midline plane. This is where we have the sternal end. It is at this point that it connects with the manubrium of the sternum. And at this middle region is where we have the middle third. And laterally here, where we have the acromial end, is where we have the lateral third. So if you drive in into the middle third, at the inferior surface of the middle third, you have an indentation created or a depression that is referred to as a subclavian groove. This is the subclavian groove here, harrowed at this point. And this groove is created for it to receive the fibers of the subclavius muscle. Remember that the subclavius muscle already has its origination point from the first costochondrial joint, which is located around the medial region. And this is directed laterally, where it is finally inserted on the subclavian groove. So it is important that we're able to highlight the details of how the fibers of the subclavius originate and where they are finally inserted upon. And this is what we have demonstrated here using this image. Now let's go to the functions of the subclavius muscle. The subclavius muscle is seen to strengthen the clavicle during movement of the shoulder girdle. If you look at this arrangement, this is where we have the clavicle, and at this region here is where we have the subclavius muscle that is highlighted in black. The subclavius, we already highlighted that is located below the clavicle, having its origination point from the first costochondrial joint at this point. Then the fibers are driven laterally, where they are finally inserted on the subclavian groove. The subclavian groove is an indentation that is seen in the middle third of the clavicle. We already highlighted this in our previous slide. And if you go to the lateral region here, this is the point where we have the acromial end of the clavicle. And it is through this end that it connects with the acromion of the scapula. And this is where the clavicle and the scapula forms the shoulder girdle. So during movement of the shoulder girdle, the subclavius muscle is seen to strengthen the clavicle, helping to add strength to the clavicle. It's also seen to help stabilize the shoulder girdle during movement of the sternoclavicular joint. If you look at this image again, at this region that is harrowed here in purple, is where we have the sternoclavicular joint. The sternoclavicular joint, as I've always said on this channel, is for us to always break down the name. This is the joint between the sternum and also the clavicle. And this is where we have the sternum here around this midline region. But specifically, it is the manubrium of the sternum, which is the upper region of the sternum that connects with the sternal end of the clavicle. And this is where we have the formation of the sternoclavicular joint. So during the movement of these joints, the subclavius muscle helps to stabilize it. And it does this by helping to pull the clavicle inferiorly and also medially. So it is seen to help pull the clavicle towards the manubrium of the sternum. And it does this in an inferior-medial direction. And it is because of the pattern by which it is seen to insert on the manubrium. It is also seen to help elevate the first rib. If we go back to origination point of the subclavius muscle, remember we highlighted that it is formed around the region where we have the first rib connecting with the first costal cartilage. And at this point here, when it contracts, it helps to elevate the rib. And when it does this, it helps to contribute or aid in the process of inspiration. So at this point is where we have the origination point of the subclavius muscle. At this region is where we have the sternal end of the first rib connecting with the costal cartilage. So this muscle is seen to help elevate the first rib when it contracts. It is seen to help elevate or push upward of the first rib. And when it does this, it helps to aid in the process of inspiration. So this is how the subclavius muscle contributes to the process of respiration. It is also seen to help prevent injury to vessels during fracture of the clavicle. If you look at this region where this arrow is pointing, this is the costoclavicular space. This costoclavicular space, all we still need to do is to break down the name. Is a space that is located between the first rib and also the clavicle. Remember, this is where we have the clavicle here, and this region where this arrow is pointing is where we have the first rib. So there is a space created between these two structures, and this space is referred to as the costoclavicular space. This space is very important because it allows for the passage of some vessels. We have the subclavian artery, and this is what is highlighted here at this point. The subclavian artery is seen to pass below the clavicle. It is also seen to run deep to the subclavius muscle. Remember, the subclavius muscle is located at the inferior part or inferior region of the clavicle. So if this vessel is passing deep below the clavicle, it will also be passing deep to the subclavius. We also have the subclavian vein that is also highlighted here in blue. These subclavian vessels are emergence from the heart of the aorta. They are directed below the clavicle so as to access the upper limb and also the trunk region where they will be giving branches to supply structures around that space. So we have the subclavian vessels passing below the clavicle and also are seen deep to the subclavius muscle. We also have the cord of the brachial plexus. The cords of the brachial plexus are also seen to pass deep to the clavicle and also deep to the subclavius muscle. They are fracture to the clavicle. These vessels are protected because they are seen to be guided by the subclavius muscle, because these vessels are seen to also be lying deep to it. So you can see how the subclavius muscle helps to prevent injury to vessels when you have clavicular fracture. So now let's go to the blood supply. The blood supply of the subclavius muscle is from two vessels. The first one is from the thoracoacromial artery. It gives off its clavicular branches to supply the subclavius. So let's see how it does this. The thoracoacromial artery is a branch from the axillary artery. This is where we have the arc of aorta. We know that the arc of aorta will give the subclavian artery, and the subclavian artery will become continuous as the axillary artery around the axillary region. And at this region, you see it giving off a short branch that is referred to as the thoracoacromial artery. This thoracoacromial artery gives off clavicular branch to supply the subclavius. Another artery that also provides blood supply to the subclavius is the suprascapular artery. The suprascapular artery is one of the branches from the thyrocervical trunk. And we know that the thyrocervical trunk emerges from the subclavian too. So from the subclavian here, we have the emergence of the thyrocervical trunk that is directed upward. This vessel then gives off the suprascapular artery that also supports in supplying the subclavius with blood. So this is how it receives blood supply from these two vessels. It is seen to be innervated by the subclavian nerve. The subclavian nerve is an emergence from the brachial plexus. This is where we have the brachial plexus here. We know that the brachial plexus has the superior trunk, the middle trunk, and also the inferior trunk. It is from the superior trunk here that we have the emergence of the subclavian nerve. It is this subclavian nerve that then innervates the subclavius muscle. So this is how we have its innervation emerging from the brachial plexus. So thanks for watching this video. Let's continue to stay glued to this channel.